Well, this segment is sponsored by Springfield Clinic.
For today's Wellness Wednesday, we have Dr. Samir Patel here to discuss sleep health. Now, Dr. Patel, this is something we do not know about on the morning show. We don't get that much sleep. But let's talk about a little bit. What are some of the signs or symptoms that you aren't getting enough sleep at night?
Well, the commonest symptom is being sleepy, falling asleep in unusual times. Maybe, stopping at a red light, you'll drift off watching TV, talking to someone, reading a book. Those are typical signs of, not getting enough sleep. Some people get very irritable and they poor concentration, they can't focus. That's typical in kids, actually. They get very irritable. Poor concentration is, unable to focus in on things for a long period of time, having to get up and around to maintain their alertness level. Very typical signs.
Yeah, you mentioned being tired, being irritable. Just talk about how if you don't get enough sleep at night, that can affect your overall health.
Yeah, sleep is very important. We should be spending up to close to a third of our lifespan, doing this to give our bodies a time to recuperate, our minds to develop. Sleep's been related to numerous parts of body health, your immunity, your brain concentration, your brain function, your cardiovascular health, heart attacks, strokes if you don't sleep enough. It affects every part of your body.
And if someone is struggling with sleeping, is it easy to get a sleep study from Springfield Clinic?
We do ask that you go through your primary care doctor. Ideally, we'd like to see them in our office to do a complete history and physical. The commonest sleep problem is sleep deprivation, where we just don't spend enough sleeping, and we want to weed that apart from people having other kind of more problems with actually maintaining a good sleep health, such as sleep apnea, where they may have problems of breathing when they're sleeping. And we'd like to get a good history and physical, so we would want to get a referral for your primary care physician to our sleep disorder center.
Okay. Do you have any advice or tips for people like, me or those overnighters out there who may not be getting that much sleep at night, but maybe a lot more naps?
So it's important to, we work in a 24/7, 365 community, but it is important to, acknowledge that our bodies need that sleep. So our occupation sometimes may not facilitate that, but as long as we acknowledge it and say that, we need to try and maintain 7 hours of sleep in a 24-hour period. Now, you may need to wake up earlier or go to sleep earlier to try and maintain that, but you got to schedule yourself in bed for 7 to 8 hours so you can get there.
All right, more sleep. I'm adding that to my New Year's resolution. Dr. Patel, thank you so much. So many great tips today.
All right, happy New Year.